you. Good afternoon, and I'd like to welcome the panelists up here as they're coming. We've noticed that you are among the people who've hung tough all day, and we commend you. We have committed to keep it popping on this panel so that you stay awake. Yes, feel free to applaud the panelists at any time. That will also help keep you awake. So, a couple of programmatic announcements. We are going to begin with questions for each panelist, and they have about 5 minutes to answer. Then we'll have an open discussion, and if it's not popping enough, I will randomly call on people in the audience and force them to ask questions off the top of their head, because that will make it more exciting. We did talk before that some people may be tempted to run over. Can you believe that? And I was fretting about this as I left my house this morning, and my spouse, who is an ex-professional soccer player and current professional coach, sent me these red and yellow cards. And he's like, nothing works better from stopping people from misbehavior than the red and yellow cards, so I know we will not need them. But if we do, one of our panelists, George, has a flight to catch, and if he runs away, it's not because he was so horrified by what happens on the panel, but rather he urgently needs to get to his flight. So thank you, George, for staying with us right up to the minute. Okay, so this panel is about this panel, sorry about that, is about water provision in the United States. And we have 5 panelists: George McGraw, Bill Becker, Marianne Langridge, Richard Krop, and Newsha Ajami. Yes, and we will begin with questions in that order and then have a free discussion. Okay, so beginning with George, as a human rights advocate who's worked on water solutions for rural Africa, indigenous U.S. populations, and underserved people, and now is a commissioner for the LA Department of Water and Power, and the director of DigDeep, you have developed a very rich perspective on a range of current and future water challenges. What do you feel the water challenge right now is really about?
Thanks. Good looking out. I appreciate that. We're already, becoming a family up here on this panel. Hi, everybody. My name's George. Thanks, Amber. I spent a lot of time thinking about exactly that question, which probably keeps most of you up at night like it does me. Here we're talking about affordability, reliability, and access. You can think of those as sort of Russian nesting dolls. Affordability impacts the most Americans, is growing at the highest rate. We have a reliability and a water quality problem, which impacts about 40 million Americans and is also growing at a pretty fair clip. And then we have access, which is the issue that I work on. We still have about 2.5 million people in the US who have no taps and toilets at home at all. Some of them in my own city of Los Angeles. Obviously, the populations in cities like Los Angeles, where we see this the most, are the unhoused, people who have no access to basic services because they have no access to homes. But just to give you an idea and kind of ground maybe the rest of this conversation in what that looks like, I do a lot of work on the Navajo Nation, where about 30% of indigenous folks don't have running water. Through the Navajo Water Project, we help people get running water and flush sanitation for the first time. And I remember my very first day on the res, not very far from here, up on the New Mexico side. I was on a water truck run by a school bus driver who would drive this water truck after her school bus route in the morning. And we pulled up to a family's house, and everyone ran out of the house with barrels and buckets and cups and mugs and pickle jars and anything that would hold a drop of water. And we filled it all up. And I followed the mom, Brenda, into the kitchen where she was making tamales. And I said, "Oh, this is great. You're going to make some tamales. Are you having family over later?" And she said, "No, I actually take these tamales and I walk down the hill and I sell them in town, and that's a really important source of income for my family." And she explained to me that the water truck was a few days late, and her husband, who was the primary breadwinner for the family, had been injured at work and had been life flighted to Gallup, about 50 miles away from their house, where he was being treated for gangrene because he couldn't keep a wound he'd gotten at work clean at home without running water. And she explained to me that, no running water and a late water truck meant no tamales, and no tamales meant no gas money, and no gas money meant her husband was still in Gallup after being discharged from the hospital and was sleeping on the street, and their family was sort of on the edge of economic ruin. And there are millions of Americans, and for the first time in U.S. history, a growing number of Americans who are facing this daily reality in all 50 states, a problem that is most closely linked to race, but also linked to income. And we're starting to see some signs that as a country we're taking seriously the fact that we have a real water crisis here in our own country, and that our expertise and resources shouldn't just be spent solving that problem abroad, overseas. And so that's sort of how I think about it. First, these folks, this core of folks without any access at all, expanding what we learn, working deeply with those communities to look at reliability and quality, and eventually look at affordability to make sure that no one else falls down to the bottom of that pyramid.
Thank you so much. Now we'll go to Bill Becker. You've had a distinguished career in developing and implementing drinking water solutions at the utility scale and in leading sustainability efforts with contributions to research and education. In the US, we developed what some people might call best-in-class water systems in the 20th century. Reflecting on the current state of these systems and everything we've heard today, what are your thoughts about current and emerging challenges? What might be future directions for the design and operation of solutions in the US and elsewhere? And what could deliver affordable and resilient water, wastewater, and stormwater management with effective governance?
Thanks, Amber. I think I'm probably going to paint it. Is it working now?
Oh, yeah.
I'm going to paint probably a different picture. My experience, is working with utilities across the country, New York to LA to Metropolitan to Denver, Phoenix, many others. And from what I've seen, most of those utilities do a phenomenal job of treating water and delivering it to customers. There are a lot of issues they face, like aging infrastructure that we heard about. There's new regulations. There's dealing with climate change and extreme weather. Most of those utilities are taking the right steps to move forward. I mean, we're implementing amazing technologies to remove nanogram per liter levels of contaminants. We have the technology to do that. We're turning wastewater into drinking water. As you heard it earlier today here, it's going on in California, other parts of the country. So I think the issues aren't really technical so much as they are governance, ownership structure, and the financial health of the community. So I think when you see the Flint, Michigans of the world, it's hard to have a viable utility if you have a failing city. And I think what kind of goes along with that is the extreme fragmentation. There's 50,000 community water systems that deliver water every day to people. There's only 3,000 electric utilities, and out of that, only 200 of them are private, and they serve 70% of the population. So there's certainly efficiencies for scale. You can't have small communities that have the wherewithal to know how to treat the water adequately to meet these regulations that are out there. If you go to the UK, there's only 11 wastewater utilities organized more or less on a watershed scale. Now, there's a lot wrong with the UK water system, but I think we could learn from that. I think water is pretty much a regional issue. Things are kind of similar. And so why the status quo? Well, I think selling utilities, they're organized in a political boundary. Well, they want to sell water at a higher rate to another utility. That's essentially one of the drivers for Flint, Michigan. Detroit was making a lot of money selling water to the neighboring counties. The county said, we can do it cheaper ourselves. They got together, and you saw what happened at Flint in the interim with that. At the same time, a lot of buying utilities, they want to control their water, but all they really do is buy it from a wholesaler, mark up the price, and then deliver it to your homes. There's too many cases of money going from the water department to other city functions. That's a real problem. And so what are the answers? I don't think they're technical. I think they're policy related. I mean, we're always going to need centralized systems. I mean, most water systems were built to fight fires. So our storage tanks, our water mains, those are all sized to deliver enough water to fight a fire. So we can't all just collect our rainwater and treat our wastewater because the cities will burn down if we don't have that centralized infrastructure. So I think we need consolidation, whether some sort of an authority or privatization is the way to go. Someone way smarter than me can figure that out, but I think we definitely need consolidation. And the politics have to come out of the utility business. You know, when major cities like New York has a mayor that said you can't raise water rates for political reasons, you cannot have a viable utility like that. And so to me, those are the real issues. And then EPA, you know, our PFAS regulation of 4 nanograms per liter is almost 2 orders of magnitude lower than World Health Organization. It's going to cost billions of dollars to do that. When we only drink 2 liters a day, you know, the rest of it gets poured on the ground, flushed down a toilet, take showers and all of that. And does that make sense to install energy-intensive processes with lots of greenhouse gas emissions? We heard all about extreme weather and climate change today. We're making that problem worse with our own regulations a lot of times. So I don't know. That's my kind of 2 cents on the thing. I think by and large, utilities do the best they can. The ones that are failing, it's mostly because it's a failing city, and the politics controls the water.
Thank you so much. That raised some really interesting questions. Oh, you're clapping. Yes, absolutely clap. You forgot to clap for George. Would you like to fix that now? Well done, everyone. Okay, right now we're just having everyone give their comments and sort of putting out their ideas that we'll be able to discuss soon. I'm keeping you awake and I'm feeling really excited about it. Okay, next up is Marianne Langridge. You have led strategic initiatives and research that aim to modernize water and wastewater industries from the private sector, have specialized in systems engineering, and have an understanding of different sectors of industry and how they interact with each other, with regulators and the public sector, and with university and industry research. What are the opportunities to build a national or global collaboratory that could catalyze the industry, addressing well-known challenges of fragmentation, regulation, and capital that have potentially limited advances that could dramatically improve services for people and the environment?
Well, that's a big question. Like Bill, I've spent most of my career supporting municipal utilities, water and wastewater, and I think the greatest opportunity is to change our mindset. It was Einstein that said you can't solve a problem with the same mind that created it. Yet we keep trying to solve the problem with the same systems that we've always had. So I think there's 3 elements of the opportunity. The first is to be brave. The changes that Bill and others have referred to of moving to more distributed systems, putting social concerns at the forefront, consolidation of the utilities, those are big changes, and they threaten the very being of some of our existing systems. Without bravery, we're not going to change that. And bravery looks like stepping back and really addressing, are we asking the right questions? Do we have the right people at the table to answer those questions? Very often we don't. Very often we gather the people who like to nod their heads and say, yeah, you're right, you're really smart. I want to join you, I want to work with you. There should be people at the table who make you uncomfortable, who really challenge the way you're looking at things, which I think leads to the second factor. We have to be wise. We've been very smart. We've got smart technologies, we've got lots of data, yet we don't tend to dig deep enough to find the wisdom in what we know. It's been sprinkled about all day today. I loved some of the snippets that everybody was sharing. And collecting that wisdom and working from the wisdom instead of from the outputs of the models is the real opportunity. I mean, we know what we know and we know what we don't know. That's what models are. That's where we do the sensitivity analyses. But we need to spend more time stating that what we don't know, we don't know. That's 90% of what's out there in the future is we don't know, and we can pretend to know and we can model those things, but we're humans, so we've got limitations. And the last piece, and this is another thing that people mentioned all day today that I thought was fascinating, is the human piece. We have to be human. And that means lots of different things, but it also means that we have to recognize that the people making the decisions, the people we're turning this data over to, they're humans too. They have bills to pay, they have loved ones to care for, and their own decision mechanisms are going to be influenced by their past experiences, their current day-to-day. And so we need to be human and understanding and compassionate with the people that we're working with when we put all these things together. So to me, that's the opportunity that we have.
Thank you so much. Now to Richard Krop. You've developed deep insights into the needs and investments for drinking water systems as you've worked for decades with the APA, RANDS, the Congressional Budget Office, to shape U.S. public health policies for drinking water and air quality. What can you tell us about the recent and upcoming changes in the national primary drinking water regulations? What would it cost to implement them over the next 20 years? Where might that money come from? And how might this impact affordability and reliability?
Hi, thank you. I do come to this from more of a public health perspective, and we do focus a lot on infrastructure and rules, but the point was well made today that this, again, is about people. That's whose health we're protecting, even though maybe the only people we talk to are engineers, and all they talk about is how many miles of pipe they're going to put in. But it was already mentioned, the PFAS rule is coming up. I believe EPA is going to finalize that by the end of the year. Their official estimate, that's $700 to $1 billion a year, and that number will probably only go up. Several years ago, they revised the lead and copper rule. That revision is now pretty much moot because there's going to be the lead and copper rule improvement, which will be finalized this fall. That's going to cost $2 to $4 billion a year for systems to comply, including inventorying and perhaps replacing all of their lead service lines. In addition to those, as part of the surface water treatment rules, EPA is looking at the microbial and disinfectant byproduct rules and updating those and revising those. For microbials, are focusing on these opportunistic pathogens, things that like create Legionnaire's disease and the like. And for the disinfecting byproducts, they're expanding the list of chemicals that they're looking at and going to regulate. When that's going to happen is a little uncertain. They just finished their consultation with their Federal Advisory Council, but that's going to be coming in the next few years as well. And these are major rules that are going to affect primarily large systems. There's some other rules that are coming out as well. There's, as part of the public right to know legislation, there's a consumer confidence report rule that's being revised to get information to people so they can make, in principle, they can make more informed decisions about their drinking water. They're also looking at a water system restructuring rule to encourage the kind of restructuring that we're talking about here. Those are probably a bit in the future. These rules are relatively expensive. Again, we are in an economy that has, produces about $30 trillion a year or so, but still $5 to $10 billion a year is a lot of money. We're not talking about the benefit side of this right now because the question is just about cost and how we're going to pay for it. The short answer is how we're going to pay for it. Primarily, ratepayers are going to pay for this. There's a lot of questions about affordability and rate design in order to protect low-income ratepayers in large systems and what systems that don't have a rate base, how they're going to handle this. The EPA does, in addition to issuing these regulations, they do provide resources, and part of that is the drinking water state revolving funds. And the federal government capitalizes those funds. And to support that, they do a survey of infrastructure every year. So the most recent survey was finished in 2021, 22. And based on that, the estimated infrastructure investment need moving forward is about, let me check my numbers, about $625 billion over the next 20 years. So the cost of these rules, while big, is small compared to the cost of actually replacing aging infrastructure. About 2/3 of that cost is actually to replace not treatment plants, but distribution mains and transmission lines, which is most of the infrastructure of these systems. There's about $100 billion of that is for treatment plants that need to be replaced. There's also $100 billion of need among these small systems, the ones that serve less than 3,300 people, which are the majority of water systems in the country, though they serve a very small number of people. The tribal need is also substantial. The American Indian need is over $3 billion over the next 20 years. Alaska Native Villages is another $800 or $900 million over the next 20 years. These are generally low-income, small systems in rural areas that face, in addition to these infrastructure needs, a range of other problems, not having the technical, financial capacity to comply with these rules. So the loan funds are there to help get money to these folks. Historically, EPA provided, or the federal government provided, $500, $600, $700 million a year to capitalize these grants. With the bill money, with the other infrastructure money that came along, last year, I believe the total grant to the states was on the order of about $8 billion, so about an order of magnitude larger than it has been. That includes $3 billion for lead line replacement last year, and again, that's part of a $15 billion commitment the federal government's made for lead line replacement. But the cost of replacing all those lead lines is probably going to be at least twice that. So it's only a portion of the money. So you're left with this question about affordability, both for these small systems or even some mid-sized systems that don't have the rate base to pay for this. And within the larger systems, the small communities. I think it was mentioned earlier today, most of the low-income people in the country live in these large systems. So the system itself has the capacity, but do they have the programs in order to sort of shield their low-income members of the community? And this doesn't get into all the other issues that have to be addressed about providing technical assistance, helping with rate design, and how you organize this complex structure with 150,000 water systems and 50,000 community systems.
Maybe we'll get into that in the Q&A. Thank you so much. Okay, Newsha, Ajami, you are our closer. So, you've had an amazing journey from doctorate in hydrologic modeling to becoming one of the most influential voices on urban water policy, on California water and national water investment and climate adaptation strategies. What are your thoughts as to the most critical national challenges with water and wastewater, given the age of infrastructure, the increasing climate hazards we've heard about today, and current patterns of water use and future projected patterns? Given what we've heard so far, how would you frame a national solution strategy and the role of research institutions in the government in moving from study to action?
Only 5 minutes. Okay, so the message today all day was, this is something I always actually start my talks with, but I love hearing everybody saying it. We have 19th century laws that define a lot of the way we divide water among ourselves. We have 20th century infrastructure that's built based on the knowledge base we had at the time, and we have 21st century challenges. A lot of these 21st century challenges cannot be solved with the infrastructure we built in the past century and with the laws that we have in the books. And that is actually a fundamental problem we are facing, because we are trying to solve these problems using the same model that we had. And actually, I use that quote all the time at the end of my talks, that you can solve the problems with the same mindset you started them. How many of you have solar panels on your roofs? 30 years ago, probably none of you would have had that on your roofs. We have technologies that can do a lot of different things. This is not a technology problem, absolutely not. This is a limited thinking problem. I sit actually on one of my side jobs. I'm also a commissioner on San Francisco Public Utilities Commission. And I constantly remind my staff there that, have you done your analysis to see how many people are going to be off the grid having on-site reuse systems in their home in the next 30 years? Their answer to me is always, not that significant, which is not true. When we talk about demand, everybody thinks demand is something we had already sorted out. In 2015, we did at the time I used to run a program at Stanford on urban water policy. And we noticed very quickly after the drought in California, water use has dropped significantly. And a lot of utilities actually would call me because of my public role that I've had over the years, asking me, is there a survey you can run and see what people are doing? We have not been encouraging people to save water, but they're saving, and we don't know why. Right, keep that in mind. So very quickly, we started a study that ended up being a very interesting one. We looked at the media coverage of the drought and how people were responding to it. And actually, that shows that people were responding to the public message that was being provided to them, that we are in a drought, we have no water, stop using. And they decided to use their significantly less water. Often utilities are told, don't worry, if people save water, that water, they're going to rebound and start using more. No rebound. Very insignificant. Every utility counts on a rebound because, exactly what Bill said, these utilities are built on a business model that doesn't belong in this time and age. They're doing a great job, yes. But based on the business model they have, based on the money they need to build all those new systems that they want to build, no one can afford their water in the next 30 years. We are passing bonds left and right to build a direct portable reuse, recycling plant, desalination plant, all these things. And think about how much of that water people use. About 30% of that water in your home needs to be super duper clean. The rest of it is flushed down the toilet, used for purposes that doesn't require super clean water. We are trying to treat water to the highest quality, send it to people's home, then they can flush it down their toilet. How irrational that is, I can't even explain. And someone has to pay for all this. And people who are the ratepayers have to eventually pay for this. And you know who's going to be at the end of that pipeline? People who do not have the money to put the solar panels on their roofs and on-site reuse systems in their buildings. So we are making this more affordable for people who actually already cannot afford this water. Someone has to pay for the infrastructure. So my comment was supposed to be something totally different, but I had to kind of like get to all these things. But one thing I would say is, one of the biggest challenges, and I'm going to wrap with this, do not show me the red card, okay? One of the biggest challenges we have is actually the fragmentation. And it's not just because we have 150,000 or 50,000. Honestly, we don't even know how many water utilities we have. These are all random numbers we are all throwing out there. Not because of that, because we also divided water to water supply, wastewater, and flood water. And these people don't even talk to each other. My utility is in charge of water supply, wastewater, and these two groups have different budgets. They don't need to talk to each other. They're not even incentivized to do projects together because that's not how their budget is defined. That's not how the rules are set. Talk about institutional challenges, right? So we need to overcome some of these actually systematic fragmentations that we have to solve our water problem, and then look into how we can actually set up a better business model for the utilities that exist and are to come to be able to invest in innovative solutions that are not constantly sort of perpetuating this centralized, once true, big gray infrastructure model that we are all so used to, and me as an engineer was trained to do, so as everybody else who has studied in engineering schools.
Thank you so much. So unless I misunderstand, we have George for 4 more minutes. Is that right? Okay, so everyone, it's time to make a difficult decision. Do you want to ask the questions, or do you want me to make up questions? Oh, since...
They're pointing to you.
I see 2 people pointed at me, but I have 2 hands and I pointed at you. Last chance to vote. Okay, we're going to do a mix. I will start with a question for George. So George, I couldn't help but notice that you suggested that one of the most important things driving water insecurity in the U.S. is race, and that did not come up in the comments of the other four panelists. So that tells me that maybe it would be valuable to the audience to hear a little elaboration about how race is a driver, and particularly around the different factors that others mentioned, such as the way utilities operate and the institutions that need to change for the future.
Absolutely. Another really difficult thing to do in a couple of minutes, but let's see if we can do it. Well, Marianne mentioned it a little bit in sort of the way we think in the U.S. as a really important or critical component of this. I don't think it'll be a surprise to anyone in this room that resource allocation in the U.S. you can peg to race. The reality is that almost 100 years ago now, we made massive centralized investments to build water and wastewater infrastructure in this country with very little data at the time to do things like tackle public health crises like cholera outbreaks, to improve economic and agricultural production in the middle of the country. All of those investments, most of those investments were made based on race and economic calculuses that were sometimes baked into the modeling but sometimes implied. And so predominantly white, higher income communities got the investments that predominantly non-white, lower income communities, sometimes right next to them, literally on the other side of the tracks, didn't get. And that lack of investment has been sort of institutionalized in a lot of the other things that we've talked about, increasing compliance burdens for water systems to clean out contaminants of concern, for instance. Those have made it much harder for these systems and these communities to catch up to the lack of investment that they had at the beginning. They sort of have to do that with one hand tied behind their back. They're not getting, or they haven't historically gotten, the free money we got 100 years ago. They've been forced to take loans instead of get grants. They've been forced to build more complicated systems than the ones other communities got to start with. And I think some of the most interesting examples of this are here in the West, where you had water systems that were built in the 1950s and 60s to serve populations that at that time were predominantly black populations, people sort of fleeing the Jim Crow South, coming out here to work in agricultural communities. Their parts of the town didn't get the investment in their water, wastewater systems, sometimes their electrical systems too. Eventually those populations moved on and were replaced by at first migrant and then permanent Latin American, Mexican American, Central and South American immigrants who are still living in some cases in California, for instance, in towns that are 1 or 2 blocks away from the historically white part of town that has service, and they still don't. So the legacy of this can still be seen today, but I think the most important thing to take home is that the reason if you're indigenous, you're 19 times more likely not to have running water in the US, or if you're black or Latino, you're twice as likely, is that we institutionalized that problem at the beginning and haven't gotten serious about creating pathways, new thinking, to help those communities catch up.
Thank you. With the other did you want to clap? Great energy. Did any of the other panelists want to comment on this factor that George has elaborated, and particularly, I think, Marianne, about your thought about a new mindset and your thoughts about a new vision, needing a new vision? Did anyone want to weigh in?
I'll say something very quick, which is I noticed I didn't connect my demand comment to the actual rate issue, which is super important. Many of the utilities have to recover the cost of service, which then translate to rates, right? So if they are bringing the water to you, treating it, you have access to it, you have to pay for the infrastructure and services and people who sit behind the desk and all that. And that is a model that has worked. And they basically they charge you based on your volumetric use. Yes, there are other kind of rate structures that have been put, and people swear by them, like tier rates and this kind of rate, that kind of rate, and none of them really works because none of them really helps anyone in the process. The challenge is eventually we have. This is service that we have to pay for, but we really don't have the right set of systems set up to make sure the rates are set in a way that we are investing in the right thing and we are recovering the right cost of service. And that's why I was just trying to kind of connect the distributed solution to that. If you're treating the water to the highest quality and you're paying for that infrastructure and people flushing it down the toilet, right? This is like inefficiency in its extreme, right? And that rate needs to reflect that. If I'm passing a bond that is supposed to invest like $1 billion in my recycling plant, right? That money then needs to be recovered through the rates. And yes, we have not done a lot of, you're absolutely right, we did not invest in communities we had to. But I would say the opportunity right now is to do the right investment, not to build a pipe and connect them to already a failing system downstream and say, we all connect them together. Now they have access to centralized system. So they have the chance of being different, being actually the leapfrog to the next generation. I think I always say the same things that you said about Africa. I think we can do it in the US. You know, like there are communities that they can use those decentralized systems, but we are not doing that. So I think the rate piece is super important because it sort of connects the investment part with the people part.
I think it also ties to something that Bill said about politics in water. We have to be very clear and transparent about the decisions we're making. And I agree, the amount of money we're spending on PFAS and the standards that are being set is a fraction of that can solve some of these other issues, or at least begin to address and rectify them, whether it's through connections or new technologies. But there isn't anyone looking at water holistically that way, especially from a regulatory perspective. And I absolutely agree. If we don't do these things at that level, we're not going to have the grants, we're not going to have the funding, we're not going to have the investment we need for water institutes and utilities to actually make these changes. So something has to change in the way we look at these things at that big scale.
There's a danger here because there's a trade-off, because what happens is people say, well, these small systems or these poor systems can't afford this, so we're not going to do it. So you end up with a scenario where these disadvantaged communities, black communities, native communities, immigrant communities, don't get the same public health protection as white communities. And we hinge it on, well, they can't pay for it, so we're not going to do it. And so the point of the federal government setting national health standards is that everybody gets the same level of public health protection. And the challenge becomes, how do we make sure that we're actually doing that? So we don't want the trade-off to be, well, we're going to lower our public health standards for these communities because they deserve the same health protection as everybody else. The challenge is, how do we make sure they actually get that health protection, which they're not getting? So, and to me, that becomes a financial and technical assistance program. I will, I usually don't defend EPA, but EPA is trying, one thing that they've been focusing on the last couple of years is this concept of environmental justice. So in all the rule analysis, built into it has to be this environmental justice component that reflects sort of this, they understand the social determinants of public health, that people living in these circumstances historically have faced environmental hazards that are much worse than the rest of us. And so are we addressing this through our public health rules? But it's complicated when you're doing that on a national scale. When you get down to LA, DWP, for example, how are they going to handle it? How are they going to address it when they don't necessarily know who's living in their service area and what their circumstances are?
Richard, rapid fire round. There's a PhD student, Shimul, who's very interested in studying new waterborne diseases that might emerge as a result of climate change. What would you recommend to Shimul that he could study for his dissertation in the U.S.?
It's a great question. A former colleague of mine who now works at the National Association of County Health Officers, this is one of the issues they're looking at. They talk about, county health officers are often concerned about disease vectors and where they're coming from. And there's an interesting issue that came up in the context of drought. And ironically, in many communities facing drought, they actually had an increase in the number of cases of West Nile virus. You would think with drought, there'd be fewer mosquitoes, you'd have fewer cases. In fact, the opposite was true because people were using less insect repellent because there were, in fact, less mosquitoes. But the mosquitoes that survived were more likely to carry the virus. So you actually had a spike in virus cases in these communities. So when we're looking at climate change and we look at some of these pathogens and whether it's a complex issue, I don't know where to start with that. As I said, some of the microbial rules are looking at some of these opportunistic pathogens that are already in the water systems. But I think there is a lot of work to be done about what those pathogens are and what pathways are going to follow.
Shimose hey so that you two can connect after. There he is, right there. Okay, we have time for one last rapid fire question. Did you notice that almost all of the speakers today talked about decentralization as a solution, but then Bill kind of popped up at the end with consolidation, which is the opposite? And did you know that this is kind of like a wonk WWF knockdown fight in the water world? You know, should we, thank you, Marianne, for nodding. Consolidation, did you know, versus decentralization? Bill, can you tell us why this is so controversial? 1 minute.
I think it depends what you mean by decentralization. I'm all for point of use devices for drinking water purposes in a house. I'm all for that. You still need to get water to the homes for all the other purposes. And there just aren't enough random supplies around the areas that aren't already allocated. So you can't, there's just taking your wastewater and treating it to the high degree and using it for drinking water is not really economically viable except on a larger scale or on a building scale type.
Thank you. I'm now red carding myself because my time is up. So thank you all so much for listening and participating, and thank you to the panelists for wonderful comments.